Welcome back to Sleep Better TV. I'm Scott Drake. My guest in studio, Dr. Mark Levy from Columbus, Ohio. We're talking about how dentists treat headaches. Dr. Levy, welcome back. Why should headaches be considered a dental problem?
Unfortunately, they rarely are. Physicians rarely think of a dental source for the problem. In reality, I've read up to 85% of what people perceive as migraines are bite related, are dental related. Physicians, they're not trained in it. I can't blame them, they don't know, but I will tell you that when patients come to me and they've had their MRIs and their CAT scans and they've tried every medication under the sun and they get minimal relief with the medications, those are slam dunks to me. I can look at them, I can talk to them from across the table, watch the way their teeth come together, and I pretty much know if I'm going to be able to help them or not.
Now, I've heard some people say that most headaches are actually just sinus headaches.
Sinuses are pretty much always in the front of they are always in the front of your face, maybe sometimes up here. Most severe headaches are here, like pressure compressing the skull here, and at the base of the skull, and there's just no sinuses there. Now the headaches might be made worse with weather changes, but that's got nothing to do with the sinuses.
So why would a patient come to you instead of, say, a neurologist or a pain specialist?
They usually come to me after they've been there, which is fine. Like I said, it's if they've exhausted all other options and they're not getting any relief, there's got to be another source of the problem. Unfortunately, most of neurology is based on treating the symptoms and with medications. A lot of people don't like to be on those meds all the time. It makes them groggy, it makes them uncomfortable. So maybe there's another solution, and more often than not, statistically more often than not, it's a bite problem.
What are some of the treatment options for headaches, and what's the success rate?
The way we treat them, like I said, we do muscle testing, and that we're observing EMGs, muscle activity. It does involve tensing. A lot of people know about tensing from being in physical therapy. Tensing is like a little electronic device that pulses the muscles, that actually gets the muscles more relaxed, it gets the blood flowing, oxygen flowing better. So the muscles are as settled as possible. And then we're able to monitor the muscle activity in different jaw positions. Once we see that muscle activity come down, we record that position and make the orthotic. It's removable. I will tell you that I start every patient by having them wear the orthotic pretty much all day. Not totally all day, but most of the day, and certainly at night. A large percentage of them end up being able to wear it only at nighttime, only when they go to bed and they don't have symptoms. Some are even able to wean themselves off enough so that they only have to put it in or wear it when they feel a headache coming back on. Then they pop it in and cut the headache right at the beginning.
And finally, Dr. Levy, does a patient have to wear the orthotic for the rest of their lives?
Well, there are other options. If someone has badly broken down teeth, plus the headaches and all the problems, as we go to fix the teeth, we simply fix them at the position that we've determined eliminates the headaches. The other option is orthodontics. Unfortunately, we see orthodontic treatment sometimes make these situations worse. But through braces, if we know the final position that's predetermined, all we need to do is move the teeth to that position, so that we call it the stomping of the orthotic ceremony. Once the teeth are moved into position, they don't need the orthotic anymore. Put it on the floor and crush it, and it's a fun time for all.
My guest has been Dr. Mark Levy, who practices dentistry in Columbus, Ohio. Dr. Levy, thank you.
Sure, thanks.
And thanks for watching Sleep Better TV.